Hello and welcome to our office, Newton Eyecare Center. My name is Dr. Lee Newton. In this short video, I'd like to explain and demonstrate what you can expect at our office for your eye examination. This is as important to us as it is to you, as we want to make sure your expectations are met during your visit. We don't want you to feel like your visit to our office is too hurried and rushed, with little or no personal attention, nor do we want you to have to sit around and wait a long time. Ideally, we strive for somewhat of a happy medium between those two extremes. Most likely, you'll be in our office for your examination for about an hour. This can change based on several factors. Reasons that you might be here a bit longer include if we're working you in our schedule based on an urgent eye condition, if you take a little bit longer to pick out your glasses, if we're fitting contact lenses and need to try on a few different lenses. Reasons that you might be here for less than an hour include visits in which we're not dilating your pupils, progress checks, and those types of things. Once you've checked in at our front desk and completed any necessary paperwork, one of our technicians will escort you into our preliminary testing room. Here some introductory data will be gathered, including visual acuity, color vision, photography of your eyes, and blood pressure. Depending on the nature of your visit, you might need some testing in our special testing room, which is shown here. Instruments in this room include corneal topography, optical coherence tomography, perimetry, and extended color vision evaluation. My portion of the examination usually involves some preliminary testing, refraction, which determines the best set of lenses for your eyes, measurement of intraocular pressure, and dilation of your pupils. Let's take a moment and discuss pupillary dilation, because many of you may have never experienced this procedure. When I look inside your eyes to make sure they're healthy, I want to look over every structure and area as thoroughly as possible. However, your pupils are neurologically wired to constrict when exposed to relatively bright lights, which gives me a harder time performing a thorough examination. To ensure the most thorough evaluation, we will place a drop into each eye that enlarges the pupil. Of course, this has some side effects, which include a little bit of blurriness with your close-up vision and moderate sensitivity to bright lights and sunlight. Some patients prefer not to drive after having their eyes dilated, and some really don't mind too much. If you don't have your own sunglasses with you, we'll supply some disposable ones to make your trip home more tolerable and safer for you and other drivers as well. The effects of dilation usually wear off in a few hours. The exceptions would be if we've had to use a more potent drop for medical reasons, or if your eyes respond more than average to the drops. At any rate, this procedure is the standard of care and should be performed every 1 to 2 years and on all new patients to the office. Reasons why we may choose not to dilate your pupils include if you come in for contact lenses and specifically ask us to dilate your eyes at a subsequent visit, if you come in for a progress check on an issue unrelated to eye health or dilation, and if you have had your eyes dilated the year before and have had no eye health issues ever. There may be other reasons, and each case is different. We'd just like to give you an idea of what to expect. While we're waiting for your eyes to dilate, which typically takes 15 to 30 minutes, you'd be free to pick out your new glasses, if that's what you're here for, or just sit and relax until we're ready to finish the examination. When your eyes are fully dilated, I will be using a couple different bright lights to assist in the examination of the inner portions. This final portion of the examination typically does not take longer than 5 or 10 minutes. We'll then conclude by discussing our findings, reviewing a treatment plan, and making sure you're comfortable with the information discussed and have had all your questions answered. We'll then proceed to checkout, at which time we'll schedule any future appointments.